Hi, my name is Lori Rugle. I'm a clinical psychologist, and I've been working in the field of problem gambling for over 36 years now. It's been the exclusive focus of my career for that length of time. And I had no desire to get into this field when I started, and I certainly had no idea what it would provide for me. But I had the privilege of doing an internship at the Cleveland, Ohio, Veterans Affairs Medical Center with their gambling treatment program, which was the only one within the whole VA system in the country and only one of two treatment programs at that point in the whole country. And I tried to get out of it, and they wouldn't let me out of it. But working with folks with a gambling disorder was so interesting, more interesting than anything else I had done in the field. These clients were challenging, energetic, and the field was wide open. It wasn't a field that had all its own answers yet. And fortunately, I job openings opened up in the field since there weren't very many at the time. That was really fortuitous. And I got to do my dissertation torturing people with a bunch of neuropsychological tests looking at attention deficit, and just have been fortunate to learn from all the experts in the field at that time, and mostly from my clients. And I've gotten to do a lot of different things because it's a small field: research and advocacy and prevention and responsible gambling, as well as the clinical work, which is most near and dear to my heart. And tried to retire for the last few years and have totally given that up because the field keeps calling to me, and I'm still interested, and it's still fascinating, and there's still lots of room for growth. One thing that I've been a staunch advocate for all the years is a need to get specific training in how to work with folks who are addressing gambling disorder, folks who are experiencing the problem of gambling and their concerned others and loved ones. Um, Certainly, when I started in the field, I'd had experience in general mental health, a bit in substance use, but when I started working with folks with gambling disorder, I realized I wasn't sure how to talk to them. Now, after a while, I realized I had a good foundation in the clinical experience I already had, but I needed to have the confidence and the knowledge behind that confidence to know exactly what I was addressing. And I've certainly experienced, both in working directly with clients and in training and supervising others, that especially when it comes to substance use disorders, there's a great deal of similarity, but there's such a significant difference. It's maybe 15, 20% of the issue that you really need to understand to work effectively with this population, or else you'll be miscommunicating, misconnecting, misunderstanding the individuals that you're working with. So that's why these core modules are so critical to get a good foundation in order to do no harm with the clients that you're working with, and hopefully to do a whole lot of good. For those folks who are struggling with a gambling disorder or their loved ones and family members, let me say this. First of all, let me put on my research hat, and a statistic that always blows me away when I talk about it. There's a very large national prevalence study done on all substance use, mental health disorders, and they included gambling. And they found that Of all the folks who met criteria for a gambling disorder, nearly 50% of those had gotten treatment for something else in their lifetimes. Depression, anxiety, a substance use issue, and absolutely none in that huge national prevalence study had gotten any help specifically for their gambling. So people may already think they're getting help because they're depressed, they're anxious, they're stressed out. They may not see exactly how the gambling is connected to that, and their provider may not ask, and it goes under identified. It's so important to realize that you may need specific help for the gambling as well as the other issues that you're dealing with in your life that are more commonly recognized, assessed for, screened for. And if you're looking for help for your gambling disorder or the gambling disorder of a loved one, please find out if that counselor has gotten training. The most important thing is to find somebody who understands, based on their knowledge and experience and skill, exactly what you're dealing with your gambling. There are many lovely psychologists like me, counselors out there who are expert in everything else. They get trained in everything else in their graduate school courses, in their certification courses. Often gambling is left out. So ask, how many hours of training have you had? Do you have a certificate in the treatment of gambling disorder? How many clients have you seen in the past year with a gambling disorder? Those are all very reasonable questions to ask of your provider because it's really important that you feel comfortable that this individual understands what you're going through. And that understanding can be the foundation for trust and change in the direction that you want to move.